Right. Can everybody see this? So we're going to talk about interviewing techniques. So this is basically how we develop a rapport with our clients and how we get them to trust us, to talk to us about their case. And this is a very important part of our case taking, because only when our case taking skills um, are strong will you be able to find your diagnosis and help your client get better and so on, right? So this is the first step towards that. So certain points that you have to remember. So through this class, we're going to talk about how we would gain our clients' trust, to ensure that they give us the information that we require to for our clinical diagnosis as well as for our therapy, for us to come up with an agenda as to how you can help your clients and so on. So to collect information, to develop that confidence in your client, there are certain things that we have to keep in mind, right? So we want them to give us the information, we want them to trust us and have that confidence that we'll help them out. And they want respect, trust, and help from us, right? So this is a two-way communication thing. Your client has to tell you, has to give you all the information that you require, and for them to do that, we need to do certain things to build that trust, to build that rapport with the client, right? So we're going to talk about all that. We're going to talk about how you communicate. We're going to talk about how we put down all the information, how you summarize it, how you finally come to a conclusion about what is the most important part of it, what you need to deal with first, what you need to deal with later, and how you come up with your protocol, with your treatment protocol, right? So we're going to talk about 5 steps of your interview process, with gradual progression from a very client-centered interview to a provider-centered interview, how you would gradually progress into that, how you build your rapport with your client, how so when you take a case, how much information the client gives you depends on your communication skills, depends on how comfortable you make your client feel. And most important thing is, your client expects a certain amount of empathy, where they don't want to be judged and they don't want your sympathy, which is very, very important. So when they share something with you, if your immediate reaction is oh, or if you do the negative nod, or if they feel that there's that sense of of pity in what they've just shared with you, they will stop giving you information, right? So the way we approach information that is being shared is very important. And most importantly, when a client comes to you, they expect that you do not judge them, which is very important. You're going to see clients who would be from who would have you're going to see a wide range of clients. You're going to see people who would be similar to you, people who would be entirely different, people who might have similar values, who might have completely different values. So while you do have a common ground of knowing what is ethical, and there are certain things that that there's a moral that you cannot give up on, but then there are certain things that you might not agree with your clients, and that's perfectly fine, because here we're not exactly making friends, right? You have to have a very professional relationship. So that relationship between a client and a physician, that professional relationship is what is very important. So we're going to talk about how you develop that, right? And certain aspects of this of what we talk about in this presentation is basically stuff that we can follow in our everyday lives, and certain things that will kind of make your life a lot easier and simpler. So what exactly do you understand when you say rapu? What comes to your mind? So this isn't like one of those lectures where I have to keep talking to you about things. This is something that it's more like a communication. So you guys tell me, what do you think about when you say rapu? Have you all taken cases? Have you all done case taking? Anybody who's done any interview with a client in this class? Yeah. Yes. A good dynamic between people. Yes. So, how many client encounters have you had? Can you just give me a number? Okay, more than one. Everybody more than one. Okay, so when you saw your first client, so everybody remember the first client, right? Because you're very excited the first time you're taking down a case, and you'll very meticulously write down everything to make sure that you don't miss out on anything and all that, right? So since all of you have seen more than one client, um, did you have the same kind of feeling when you met your first client and your second client or your third client? So have you had the same kind of a rapport with your different clients, right? So sometimes when you see a person, you immediately have that connect with them, right? It can be a client, it can be a fellow student that you're studying with, it can be anybody that you meet, right? So with your clients, that's the thing. Sometimes when people walk into your clinic, you immediately have a connection with them, and sometimes that doesn't happen, right? So how you build a rapport with a person depends on how you ensure that you build that rapport as naturally as possible, whether you feel that connection immediately or you don't. So when you have a client who walks in, you don't necessarily have to feel either a friendly connection with them or anything. You need to slowly develop that skill where you're able to build that rapport with them such that your client is able to trust you, is able to give you information, and has that confidence that you can help sort his or her issues. Does that make sense? So you have to have that sense of understanding, and that's something that happens mutually. And that relationship, that relationship that you develop with the client, where you ask them a question, or you ask them what their issue is, and they start talking to you. The more natural this rapport is, the more information your client would give you. Does that make sense? And what do I mean by natural rapport? As in, you can't forcefully try to build this relationship that you have with your client, right? So all of us have different ways of dealing with people, right? Would you all agree with that? Some of us are very friendly. We meet someone, and we would instantly connect with that person. Some of us are a little more, we might be introverts, where we might take time to open up. We might take time to connect with people. Some of us are a little judgmental. We see someone, we would immediately decide whether we like them or we don't, right? So each of us have a different way of connecting with people. But when we are a physician, right, when you are sitting in your clinic, this particular thing that I was talking to you about cannot exist in a physician. So when a person walks into my clinic, I might feel a kind of warmth with that person, and I might be able to build a rapport very easily with that person, and that's perfectly fine. But I cannot allow that warmth and that feeling of comfort, become too personal, because then I'm not going to do justice to my job, right? Similarly, when someone walks into my clinic, the very sight, the very way they walk in might, be a little irritating. They might walk in, they might seem arrogant, or anything, any kind of a negative emotion can be attached to it. I cannot allow that to take over, my job as a physician. Does that make sense? So how I Yeah, so I have to make sure that I behave very similarly to all the different people that come into my clinic. My personal relationship, how I can personally be friendly, or if I'm an introvert, or if I am a judgmental person, or whatever I am, that cannot affect my job. That cannot affect the way I build a rapport with my patients, with my clients. And some people do it very easily. For some people, it comes very easily. For others, it might take a little bit of time. But you don't forcefully try and build that rapport. It's not, it's not like those it's not like those calls where you have a binder and you go by the binder, where you ask a question, they say yes or no, then you have your second question. So that becomes forced, right? So you can't do that. You need to slowly. And how do you learn it? You learn it by watching people, by shadowing different doctors. It takes some time, but you will slowly learn, right? You cannot forcefully build rapport with a person. You cannot forcefully try and build that connection with a person. It has to come in naturally. And that connection, and again, by naturally, the transition that you have in your conversation, how you talk to your client when they come in, what you do, the way you greet them, the way you tell them to sit, all that makes a difference. That initial 1 or 2 minutes, completely, that's all it takes for your client to decide whether they like you or they don't like you. Does that make sense? So as we go ahead with this, I'm going to give you examples from from different client encounters that I have had over here. So it might probably help you if you come across similar people. It might help you, right? Since all of you have done like a handful of client encounters. If you have something interesting to share, put it in the chat box, so then everybody can everybody can read and benefit, right? So what are we going to do with the client that comes in? So the client would come in, they would tell you what they need, they would give you, they would tell you their issues, they would tell you that this is what the problem is, this needs to be checked, needs to be corrected. And we'll have different kinds of clients. Some of them would come and they would give you so much information and you have to figure out what to deal with first. Some might come, they might hardly speak to you about their issue, and you again have to figure out what to deal with, right? So what are we going to do? We are going to give them recommendations. We are going to make changes to their lifestyle. We're going to make changes to their diet. We are going to recommend chikitsa protocols. We're going to give them therapies, right? And for that, we need to understand what their issue is. We need to get the correct information. So some clients might underplay their symptoms, some might exaggerate. So you need to slowly develop that skill where you're able to pick what you need to take, you're able to summarize it, and then come to a conclusion. So this is something that you develop as you keep practicing. That experience is what will help you understand that, right? So initially, what you can do is you can take down everything that they tell you, and then you can you talk to them for a while. You'll know what to cross out, you'll know what to give importance to, and then you can make your chikitsa protocol, and then you can make your plan. Now what is important, you need to communicate the recommendations very clearly, because if you don't tell them what they need to do clearly, they might not follow what you tell them, and they might do the wrong thing, and that's not going to help them. So you need to be very clear in terms of what you recommend. Also, you need to create that environment where your client is able to comfortably discuss their fears with you. They're able to talk to you openly, right? And they should know very well that if they give you a protocol, if they tell you something, you're able to work around their comfort zone. So sometimes when we give a chikitsa protocol, some recommendation that you give might not be acceptable to the client. They should be able to tell you that, and you should be able to work out, a solution where your client gets benefited as well. So, say for instance, they do something that's a direct influence on the as a nidana, that directly acts as a nidana for their condition. Say for instance, they eat something, they're allergic to it, and that immediately causes a condition. And if your client says, oh no, I cannot stop eating that, that's not acceptable, right? Because whatever you give them, if it's an allergen, it is going to cause problems. So then that's not acceptable. So you need to help them understand that, and they will be able to take your recommendations only if they trust you. So that rapport that you build is important, because after that you're going to make major changes to their routine, to their diet. Does that make sense? Now suppose you give them a patya where you tell them that say for instance, stewed apples might work well for a condition that your client has spoken to you about. So you tell them that, oh, you need to have this, or say, you want to give them an anupana of buttermilk, right? So you tell them that, okay, with this you have buttermilk as an anupana, and that's what is going to give you maximum benefit. But your client might not be okay with it. Maybe they don't like the taste of it. Maybe they don't want to try it. And as long as they don't have an allergy, but they don't like it, they don't even want to try it, they would tell you that that's not okay with them. So you have to be able to give them another option to, you need to give them another alternative. Similarly, sometimes when you discuss your chikitsa protocol, wherein you tell them that you need to have, maybe say for instance, you recommend a panchakarma and they tell you that they don't want to do the panchakarma. You should be able to discuss and help them understand the importance of it. But finally, if they're still reluctant to take it, then you need to come up with an alternative. Does that make sense? So as you give your chikitsa protocols, as you tell them what you need, yeah, you tell them what they need to do. Everything that you say is not going to be acceptable to all your clients. That is very important to understand. So when they tell you something will not work for them, certain points, since whatever is there in this presentation is very clear, very easy to understand, I'm going to tell you certain things that we do in our client encounters, so that will kind of help you understand. So in case something is not acceptable to your client, right? So I have some patients who will come and who will refuse to have internal medicines because they would have gone to an allopathic doctor, right, who practices modern medicine. And I've had a patient who came and told me that they cannot have any internal Ayurvedic medicines because these medicines can have harmful ingredients that can cause kidney problems, right? So she refused to have internal medicines, and she said that she just cannot have internal medicines, and she had aches and pains and whatever. So the best thing that I could do is I cannot force her to have internal medicines because she's completely against it. So the first step was I tried explaining to her, but she said no. So the next thing was I gave her an alternative where I gave her only external therapy to use. Right? I've had clients who will come with a lot of issues. So I had a client recently. I've been recently, as in he's been coming to me for the last 4 months. So he has a lot of issues that he needs help with. But this person eats only non-veg, doesn't like vegetables. He likes only bitter gourd and one other vegetable, which I don't remember what, but there are just two vegetables that he would eat. And he doesn't like, and drumstick leaves. These are the only two vegetables that he would eat. And he doesn't like any other vegetable, and he has only prawns, meat, and that's what he has 3 times a day, right? So he came and he needed a lot of dietary changes. He needed a lot of lifestyle changes. There was this client encounter took a really long time. And why? Because he would keep arguing. He would say, he wasn't okay doing most of the patya. He wasn't okay with most of it, right? So it reached a stage where he wouldn't accept anything. He wouldn't, he nothing was okay to him. If I tell him that, you need to include more vegetables, he would say, no, doc, I can't. I don't like vegetables. I can only have bitter gourd. I can only have drumstick leaves. I don't like any of the other vegetables. His cholesterol was skyrocketing. It was really high. And he said, oh, you know what? I can't stop eating red meat. I love it. I like it fried. And he would have, so there's this Indian there's a dish called biryani. Are you familiar with it? It's rice and meat and all of that, right? So he would have that 4 times a week. And that was his thing. Oh yes, it did. So he took a really long time. So finally I felt like an attorney sitting and having a negotiation with this client of mine, because anything you say, he would be like, no, it was all objections. And, oh no, I can't do that, I can't do this. So you might have clients like that also. Very important not to lose your cool. You need to keep calm. You cannot end up fighting with your client. You cannot, so you need to be calm. You need to make them understand You need to make them understand what you're trying to tell them. You need to slowly work with them. And this client took me about an hour and a half, the first visit that he came to. So finally, after we spoke for a very long time, after I explained his case to him, after I had all the blood work in front of him, marked everything. So I basically treated him like, how you would treat a toddler. So after having everything, shown all the figures and everything, I marked it all out. And then finally I had to tell him that, what, if you don't follow these certain things, then there's nothing that I can do to help you. Because if he can't have anything, and if he's going to have only meat and, eat and drink whatever he feels like, there's nothing I can do to work with him. There's a limit to what your herbs can do, right? So then finally, after 1.5 hours of trying to build a connection with him, he finally came to a conclusion that he would start working. So now in 4 months, his diet has changed quite a bit. His routine has changed quite a bit. So sometimes your clients will take time to, to understand what you're saying. So you need to slowly help build that level of trust with your client, right? And sometimes when they don't accept anything, you need to work with them. You need to make it look like you're actually you're accepting what they want you to do, and then slowly try and change their diet and bring it to whatever you want to, right? So for people who have issues changing their diet, changing their lifestyle, you need to help do that slowly, so they don't feel that change like overnight. If you bring in a lot of new things into their diet, they will not come back to you, right? So this is something that we need to slowly help build. So the first step when someone comes in is you welcome them. So you use your client's name, you introduce yourself, a little smile, and they should feel welcome. They should feel that they can come to you and they can talk to you, right? Ensure client readiness and privacy. Very important. Your client has to know that whatever they tell you would, stay there. It's private, it's confidential. And if you have other clients waiting out, you need to make sure that there's something where the door is shut and other people outside cannot listen to what you and your client are discussing. Remove any kind of communication barriers and establish client comfort. This is the first step, right? Then you need to elicit the chief complaint and set an agenda for the visit. So the first thing is you indicate your available time, and you obtain a list of issues that the client wants to discuss. So you guys have to have them fill out a form before they come to you, right? Where they kind of, you have a little bit of an idea about what the prakriti can be like, and so on and so forth, right? So you'll have that information in front of you, and then they'll talk to you about all their issues, and they'll talk to you about their problems, what their issues are, and so on. And then you summarize and you finalize. So you prioritize the items that are there. You prioritize what you need to do first and what you need to do later. Like for instance, if a person comes to you with armor along with other issues, your priority is to check and correct the armor first. So that would be the first agenda. First thing to do would be uh, to work on the armor. So after a few days of working on the armor, then you can work on other things. So the first part would be armor and agni. So along with that, if you give medicines for the other conditions, it might not necessarily work. So that becomes your priority there, right? Like that, depending on the condition, we have different things. Like sometimes, if you decide we're doing a panchakarma, you'll again have a list of how you would want to work out the therapy protocol. If you have a client who has a list of issues that you need to check, then you need to work accordingly. So depending on your client, you, with all the data that you've collected, you decide what needs to be done first, what goes for later, and so on. Start with the main complaint. So ask open-ended questions to elicit the problem, so your client feels free to talk to you about their issue, right? Where they tell you what all has happened, what is troubling them, what needs to be checked on first, and the intensity of their problem. So like I told you, some clients would come, they would start talking, and they would go on and on and on, and sometimes they would deviate, go to a completely, completely irrelevant portion of what. So you need to gently bring them back to what they're talking to you about. If they are going on track, they're telling you exactly what the problem is and all that, then you listen to them. They need to know that you're actively listening to them, so you don't look distracted, you don't, you know so even when you write down stuff, that when they're talking to you, wait for them to finish, wait for them to, tell you whatever they want to talk to you about, and then you can start writing. So as they're talking to you, you don't take notes, as they're talking to you. Certain things definitely you can note down. I'm not telling you that, you need to put your pen down and listen, but certain things you can note down. But don't do what you would do like when you listen to a class where you're taking notes, right? Don't do that, because then your client won't have that, won't feel that you're actively listening to them. So eye contact is very important. You need to, listen to them. That silence that you have, so they can talk without being interrupted, and encouragement where you nod your head, or you let them know that you're listening to them, right? So that is very important. So as they start talking to you and as they start explaining their problems, you will know what their most important, what the chief complaint is. So that becomes the issue that you need to focus on first, what you need to address first. If it doesn't make too much sense, or if something else comes up, then you can decide accordingly. So as they talk to you, you can figure out what the chief complaint is, right? um, in the US and all that, you have only your client who will come in, or would you have an attender who comes in as well? In India, we have attenders who come in as well. So there'll be relatives of the patient. There would be, family that comes in. So in some cases, like I had one recently where a brother brought his sister, and the sister started talking to me about her issue, and then the brother started interrupting, and then the brother started talking. The brother started, giving information. It is very important for you, if your client, unless your client has some issue where they're not able to talk to you, or like if if your client has paralysis or has a condition where the client is not able to talk to you, or if it's a small child. Apart from that, if your client can talk to you, please understand the complaint from your client. Does that make sense? Because no one would be able to explain what their issue is as well as the person who's suffering from it, right? So in this case, the brother kept talking. The brother would tell the complaint, and then the brother would talk about how his sister is not taking care of herself, and then would talk about, um, okay. So here we don't have that. Here, family is, everybody would walk in with the client. But in, okay. But in certain cases, when like in this case, I had to politely ask the brother to leave because the sister was refusing to talk. So yeah, so it's important for you to listen to the issue from the client, right? And then this portion is what will help you understand what you need to focus on first. So use focus but open-ended questions um, to obtain information about the physical symptoms, what your client's emotional symptoms are. So you need to understand, in terms of Ayurveda, you need to understand the doshas physically. You need to also understand the manasika dosha levels, right? You need to see whether there's tamas or whether there's rajas, or what you're dealing with. You need to see, so as they explain things to you, as they explain, yeah so yeah. So as they explain, you will get an idea about what doshas and what kind of vikriti you're exactly dealing with. So that is something that you need to note down, that you need to, you can note down points to help understand that. And you should understand physical, emotional, social, all those symptoms you need to understand. Um, so here you get maximum information about the main issue, associated complaints, so your chief complaint, the associated complaints, you can you can, whatever they talk to you about. So sometimes they would talk to you and then they would talk to you about the surgical history, they would talk to you about family history, they would talk to you about all that. And sometimes they wouldn't, they would just talk about certain things and then you have to ask them questions. So you generally start your client encounter by asking open-ended questions where you invite the client to share with you, where they can talk to you without being interrupted, where they can explain everything that they want to. And then you move to the next stage where you ask them certain specific questions so you're able to figure out what is wrong with them, right? So like I told you in the beginning, how much you understand, over a period of time, as you keep practicing, you will understand what needs to be included in your case sheet and what can be omitted from what your client is talking to you. So and this holds good for all of us. So initially, when I was doing my internship and then when I started shadowing doctors, so we would do the initial case taking would be done by us, and then the main doctor would check and do everything. So in that initial thing, the case sheet would be full because you don't want to miss out on anything. You want all the information to be there, right? So your case sheet would be packed with information. But as you keep practicing, you'll realize that you don't need such a packed case sheet. Your case sheet can have just what is very important. And how do you know that? It's with experience, right? So as you keep doing your client encounters, you will get more and more confident about what needs to be there on your case sheet and what doesn't. So if you people have copies of your first case sheet, keep it safely. And as you keep taking your case sheets, you can check and see how much of difference is there in your case taking, right? So the kind of questions that you ask, the first part would be open-ended questions where your client will tell in their own words, what their issue is and all that. And most important thing is when you write chief complaint, right? Or when the first part of your case sheet should always be in your client's words. So if your client says, I have, say, a throbbing pain, note that word down. That is what your client, that is the information that your client is giving you, and that is very important. So the first part of your case taking is always in your client's words, right? So they would tell you the duration, they would tell you the description of their problem, they would tell you, so that information, what kind of pain they have, what kind of symptom they have, how long they have had it. Sometimes people would tell you that in the morning when they wake up they have stiffness, and then they have severe pain. So write that down: morning stiffness, severe pain. That is very important because all that is what will help you when it comes to your diagnosis and your differential diagnosis, right? So after they're done with whatever information they have to share, but you feel that it's not over, you still need some information, then you start asking close-ended questions, like specific questions where you want specific information from your client. So that is what you use when you fill in details, when you're trying to gather some specific information from your client. Say for instance, say so your client has told you that they have some they have morning stiffness, right? You can ask them, and they've finished explaining that. Now for your differential diagnosis, to understand whether it is sandhivatam or amavatam, you need to know whether this morning stiffness becomes okay on its own after waking up and after doing a little bit of getting out of bed and doing a little bit of your work, or whether the stiffness stays on for a little longer, or whether it increases when you do work. So that becomes very important for your differential diagnosis. Does that make sense? I'm just giving you an example. So if you feel that the information is incomplete and you feel that you need a little more little more data to come to a conclusion about what the problem is and what kind of therapy needs to be given, you would ask them some specific questions, right? So when they talk to you, say for instance about stomach pain, and they say, I have severe stomach pain, and this is what happens, that is what happens, and now you have a doubt whether there is some kind of an whether there's some kind of say if there's ulcers or if there's something like that, then you can ask them questions. Like you can ask them specific questions, like when do they have that pain? Does it subside after food? Does it increase after food? That will give you an idea, right? So if dosha related questions, if they've given you a lot of information but you have a doubt whether it's a vataja thing or a kaphaja thing, you can ask some questions about the swelling that they have, or whether there's a burning sensation, and some small things like that will help you identify the type of issue you're dealing with and would help you for your conclusion, right? And you generally try and avoid leading questions. You don't ask questions where you have an expected answer that's already there in the question, like you don't drink alcohol, right? Or you're a vegetarian, right? You don't ask them that, because then the client feels obligated to give you an answer that you're expecting. Now what happens there is you don't get complete information. They kind of withhold information from you, and you will not be able to give them the right kind of diet, and you won't be able to give them the right kind of patya and herbs. So that's very important. And the final step is when that transition happens from practitioner, from a client centered interview to a practitioner centered interview, where you summarize the conversation that you've had with them and you confirm the accuracy of the information, right? So once they've told you everything that they have to, you would summarize that conversation and you would ask, you write it down in your words, and then you check the accuracy. So you ask them, you say, so this is what you said, right? Am I correct? Is this right? So you ask them that, and then you have your accurate information in that precise form that you need to help understand the issue, to help diagnose the issue, and to help treat the condition, right? So this the duration of these steps would depending on the client, the practitioner, how experienced the practitioner is, how serious or severe the client, the condition is, and so on. So when we start, we would all take a really long time to do this, because you don't want to miss out on any information. So you'll have all the information. As you gain experience, as you keep practicing, the duration would shorten. When you're a very experienced practitioner, when you would take a really long time is when you have a very difficult case, or when you have a very severe condition which requires that kind of time, where you have a lot of information that you need to attend to, right? So depending on the client, depending on the kind of condition that the person has, this duration for these few first 5 steps would vary, right? So you gather all the information that you require. So you will have a questionnaire or a checklist. So you gather all the information that you require. What is important is there needs to be a flow in your interview. So you don't start a question and it's not like a quiz where you ask a question and then you completely move on to something that's not relevant, or you don't listen to your client and you make them feel that I just said something and my doctor doesn't really care. She just moved on. She or he, has just moved on to the next question and so on. Right? You need to pay attention to what they tell you. Right? Do not react to their answers. Do not react to what they tell you. Like I told you, your client doesn't want you to judge them. Now, if they've given you some information, like they've given you some information that's a little hard for you to listen to, or something that makes you feel bad, or you have that sudden wave of sympathy that comes in, don't show that out to them. You can keep quiet, you can have a little bit of a silence where your client, if your client wants, they can share a little more with you. If they have shared some kind of, say for instance, you've asked them if there's any stress that's happened in their life, or if you've asked them if there's something that, suddenly caused certain symptoms, And if they answer, they say, if they, like for instance here, they're saying they've lost their job, don't immediately move to the next question, where you ask them, okay, so what is the other symptom or something like that. You need to help take that little, those few seconds there, where you can actually deepen the rapport that you've built over the last many minutes of your interview, where you show a little bit of sympathy. You can pause, you can wait for your client to continue, or you can even ask them, you can even tell them that, if they want to, you can have that positive gesture where you're actually encouraging them to continue with what they want to tell you. If they don't want to talk to you about it, then you don't press, you don't keep asking them, you move on to the next thing, right? All this is very important. It might seem like a lot to do, but you will learn it. It's pretty simple as you keep talking to your clients. So when you move from one topic to another, you need to use something called a transition, so it doesn't feel like you've suddenly jumped into a completely different area, and you take your client by surprise. So you can do this in a few ways. Now, just an example of how awkward this can be is, say for instance, you're watching a movie, and suddenly from one scene your movie skips to a completely, irrelevant, unconnected portion. Just a sudden jump, and you suddenly feel like, oh, I've missed out on something, right? That kind of a jump can suddenly make your client feel that you have lost interest in what they were talking to you about. Like, say for instance, they're talking to you about that they've lost their job, and that's been stressful, and they've been having some issues and all that. You listen to that, and then you're like, okay, so your stomach has been hurting, or you say, oh, so let's check what's wrong with your foot. So your client would feel that you have no interest in what they've just told you, and they might slowly, they might stop communicating as well as they had started off. And that happens very commonly when they feel that you're not interested in what they're talking to you about. So you need to use a transition to move to a different area. So once they're done with what information, with whatever they've told you, and when you want to move to a next thing, you can tell them that, you can directly tell them that. You can say, okay, so I have all the information that I need about this, so now I'm going to ask you a few other, I'm going to ask you some different questions related to whatever you want to jump into. So they expect that jump. Does that make sense? So that becomes very important. Listening skills, very important everywhere in our personal lives, in our client encounters, and just how we deal with people. So, very important thing, pay attention when someone talks to you. How many of you here at home use your phones when a family member is trying to talk to you? Give me an honest answer. Yeah, no, it's something that happens very in today's day and age. uh, when you have a gathering, it can be your friends, it can be your family. Everybody is busy on their devices, on their mobile devices. They don't want to talk to each other, right? So what happens is you're in touch with people who are not in the room, but you're far away from people who are in the room, because you are not listening to people who are talking to you. um, something, I have patients who come and do that. As they're answering questions, a call comes and they would say 1 minute, and they would pick up the phone, and then they talk about some vegetable that needs to be bought, or they talk about some very random thing. So I have a rule that when they come into the clinic, they cannot use their phones, and I do the same thing. So I don't attend calls when I'm with the patients in the clinic. It is very important for your client to know that you're listening to them. So you need to pay attention. You need to ask for clarification. You need to give them those positive gestures where they know, nod, pay attention, listen. You encourage them to speak more, right? So this is the most important step towards building a rapport with your client. So as your client talks to you, if you're busy checking your phone, or you're busy doing something else, or you're like, yeah, continue talking, and you're busy writing down something else, they will not communicate, right? Similarly, you can ask them, if they stop, you can pause for a bit, you can wait for them to talk. If they don't, you can also ask them things like, can you tell me more, can you explain a little more, and things like that, so they know that you're listening to them. And you ask questions to clarify. So if they've said something to you and you need a little more information to help with your case taking, you can ask them those questions, right? So how you talk to them, how you ask them the question is very important. You cannot talk to them rudely or arrogantly and expect them to, answer. You need to be polite, you need to be courteous. At the same time, do not allow your clients to take over the session. Does that make sense? So you might have certain overbearing clients who you would see in your practice, where they come, they talk, they would tell you what to do because they've already done their research, they've Googled everything, they've filled all your Vata Pitta Kapha forms. They come to you and they're like, hey, you know what? I have Pitta Prakriti, and now I think I have this Vikriti. I've already started having triple. I have patients who come and do that. I already have started having Tripla tablets, and but I don't feel really good. So, can I have this? Can you give me this? I, in fact, had a patient who came and told me what medicine he wanted. So I told him he can go buy it, at some other place. So don't allow your client to take over the session. You need to be in control of the session, but not in control of your client. Does that make sense? Yeah. So your client has to know that they are in your clinic. You pay attention to them. You develop that rapport with them. You get all the information that you require. The therapy protocol is yours, right? So you have moved from the client centered interview to a physician center, to a to a physician centered interview. Now you have to decide what the protocol is. You have to check for accuracy, make sure you have all the information, and you take control of what is happening in your clinic, right? That is very important. Also, if your client has said something and you're not completely sure about what they've told you, you can ask them. You can recheck. Just make sure, and you need to ensure that your final case sheet with the summarized form of whatever you have is perfect information. It has to be accurate. You cannot have anything there that's not right, because that would affect your treatment protocol, right? Also, I know it's not related exactly to what we're doing today, but if you have clients who come and you feel that they're not going to cooperate with you at all, don't take the case, right? I don't know if see, sometimes you need, so sometimes you will have clients who will not, who are who just wouldn't cooperate with you, right? I've had that a lot as well, where they'll give you, you'll have clients where they have issues accepting what you tell them. That's fine, you can talk to them about it. You need to clarify, you need to tell them exactly what you do, right? Now, if I'm going to decide that I'm doing panchakarma, but I'm going to start off with, say, snehanam and swedanam, and I have a agenda in mind, I need to explain my treatment protocol to them. I cannot tell them, what, do this, come back in 5 days, then next thing. I can't do that. I need to explain to them what, what we need, what we have in mind has to be explained to them. Now, if they, and you also have to tell them that if you do this, you might have a little bit of, suppose, say they have some condition, you give them something and that's going to aggravate the pain, you tell them that, so they are prepared for that. You have to ready your client in what you're going to do, right? We don't have a refund system here, but yes, I've had two very bad clients, and I stopped taking their case. So I had one client who had a very bad, who had psoriasis, and hers was very, very severe. She's had this condition for almost 30-40 years, and she would still use a dishwashing soap that you get for very cheap, that powder, she would use that powder, and that would give her nail had her nail had a very bad attack once, and both the fingers. So she wouldn't follow any of the patyam that was given to her. She wouldn't follow anything. She would only have the tablets and use the oil, and she would still continue to wash vessels. Absolutely no cooperation from her. And then she came and she created a scene saying she wasn't getting results and she was on steroids for almost 30 years before she came to me. And when she used it, so in between, she had someone who came home and stayed, and she was religiously applying the medicine and doing the patyam and everything. And she started feeling better because she came with cracks, oozing pus and everything. It was really bad. But then when she started feeling a little better, when that stopped, she again started, doing that. And yes, she didn't get results. So after treating her for a few months and repeatedly telling her and talking to her, and then when I realized that she's not going to follow, I stopped taking her case. So I've had that. But we don't have this refund system over here. But I did have a client who you'll see all sorts of clients. I've had a client who once came and she finished her treatment and everything. She didn't follow the final part of it after doing Abhyanga. She didn't follow the rest and all that. So she went and she complained to her father, and they didn't pay the full amount. She said she won't pay because she didn't follow and she didn't feel better. But yes, I've had those patients. Did you have someone who came and asked you for a refund? Don't deal with such clients. You need to politely tell them that you won't treat them anymore. If you've had someone who's asked you for a refund, unless you offer a refund in your clinic, because if something doesn't work, if you offer a refund, then they're going to use that. They would definitely. You haven't? Okay. You'll see all sorts of people. You would always have good clients who'll come and who tell you all nice things about you. You'll have everything. So don't take the good comments to your head, and don't take the bad comments to your heart. You need to know where to draw the line. Very important. So if you feel your client will not cooperate with your treatment, you need to tell them that, if you don't do whatever I am asking you to do, you're not going to feel better. You need to tell them that right at the beginning so that they know, they can't do what you tell them. See, in Ayurveda, we give a lot of importance to this patya, right? So if you don't follow the patya properly, you're not going to feel better. If I have a vata condition and I continuously do things that would increase my vata, I cannot. There's no medicine. I can have Dashmula Kashayam, I can have all the vata pacifying herbs in the world, and I still won't feel better because I'm constantly doing a nidana that is going to increase my vata, right? So if you have a client who you think will not cooperate at all, then please, that you need to tell them, right? Okay. So yes, exactly. In India, we don't have that. We don't have legal forms, and we don't have that in India. But then there are some patients who would directly tell you, who would tell you that, I'm sorry, I didn't do it and it was my mistake. And then there are people who would lie to you and tell you that I've done everything and I still didn't feel better. See, the thing with Ayurveda is when you do Nadi examination, right? You can understand if they've followed your changes, lifestyle changes, if they've had the herbs the way you've asked them to or no, because the nadi will not lie. That's the thing with Ayurveda nadi. So if you have a client, you ask them, have you did you say, for instance, if you ask them if the bowels are okay, and if they've had a bowel that morning, they would tell you yes, because some people find it a little embarrassing to talk about it. You examine the nadi, you'll know if they've had a bowel movement or not. So that's how powerful the nadi is. So I had a patient who once came to me drunk, and he refused to accept it. One, he was smelling of liquor, he refused to accept it, and the nadi was full. It was like all out alcohol. Like you touched the nadi, you could feel the alcohol. So yeah. So importance of silence, right? No, I don't. I don't. Yes, that also happens. Sometimes when you examine the nadi, you know you can't do anything. I don't take clients when I know they won't cooperate. I don't take clients if they are drunk, if if they are against a certain code of conduct that I follow, then I don't take them. If yes, yes, absolutely. So okay, so sometimes you'll have clients who would, only give you a one word answer, who wouldn't explain in detail. So in such cases, a little bit of silence with, with eye contact, with certain gestures where you nod your head, you move, lean forward, they can communicate our interest to listen, to hear a little more, encouraging your client to elaborate, right? Sometimes when your client is exhibiting strong negative emotion like anger or anxiety, or sometimes your clients would start crying, if they've had a lot of issues at home, if they've had trauma, they would really start crying. And a little bit of silence, allowing your client to vent, would help your client feel better. So it would help process their emotions, and it would help them feel better, right? uh, Sometimes if they are providing adequate information, then you allow them to finish, you allow them, and if they pause for a bit, you don't interrupt, you wait, you let them gather, collect their thoughts, and then continue, so they give you all the information that you require. So in certain cases, awkward silence might not be a good idea, but some silence in certain cases, in certain situations, is very important, because that will help build that level of comfort for your client, and then they can continue. See, another important thing is to make sure that they know you don't judge them. It can be their gender, it can be something that they've done, it can be something that they believe in. They can talk to you about something, it might be, a habit or a belief system that you don't share with them, but uh, that is not for you to judge, right? All right, I'm done with my time here, so I'm going to stop here. And
I'll finish this presentation.
all right.
Thank you,
so much.
Priyanka ji. Let's take a 2-minute break and then we'll get started with another presentation by Dr.